On the final day of the 77th World Health Assembly over the weekend, members of the World Health Organization agreed on revisions to the International Health Regulations, that's the IHR, even as they failed to pass their pandemic agreement or their accord that they wanted so desperately. This was a tremendous power grab by the World Health Organization. However, it's not good news. Even though they failed to get the pandemic accord, some of these amendments to the international health regulations are quite extensive. So what does this mean for national sovereignty, for the well-being of your family, for freedom-loving people everywhere? Well, joining me now to discuss kind of the wrap-up of the 77th World Health Assembly is Travis Weber, who attended the assembly there in Geneva. He's the policy editor for the Washington Stand, as well as vice president for policy and government affairs here at the Family Research Council. Travis, welcome back to Washington Watch.
Thank you, Tony. Good to be with you.
All right, so there's I know that the dust is still settling, but there's a lot of what I would describe as inaccurate information surrounding the final actions. I mean, it was not good, but I think we need to be very precise in how we detail what took place so that we'll know what we need to do going forward. So help us clarify what actually happened in the final hours, the 11th hour of the assembly, and the amendments that were made to the international health regulations.
Yeah, so Tony, there are two things that happened in the waning hours. The Assembly agreed on a pathway ahead for the pandemic agreement, even though they didn't pass or agree to any pandemic agreement text. The second thing that happened is that there were amendments agreed to the 2005 version of the International Health Regulations. And these amendments, the language for the amendments, passed in a final version of those by consensus, meaning no state objected to their passage later on Saturday night. So throughout the week at the World Health Assembly, delegates and states were trying to come to some agreement. It actually took them longer than perhaps anticipated to agree to the amendments, and they never even got the pandemic agreement done. So what we saw is a slowing of the process, not as smooth as they'd hoped. Nevertheless, they did pass amendments, and these are amendments to the health regulations, which have been in existence since 1969, several iterations, the most recent one in 2005, that are designed to be used by nations when dealing with the spread of diseases internationally. And it's understandable. These are used in cases of yellow fever and other type of diseases that spread and have actual harmful health impact, health effect. The most recent version is dealing with the post-COVID era. So a lot of people are watching the World Health Organization post-COVID, and that's why there's a lot of scrutiny on these right now.
All right, Travis Weber, before we get into the amendments to the international health regulations, I want to go back to what you said about the treaty, the pandemic accord, which they did not get done, but they agreed to a way forward. So how is that different in terms of the way forward? How's that different than what they had going into this? They've been working on this treaty for 2 years, unable to get it accomplished. So what does that way forward look like?
Yeah, so they've been working on text to try to agree among all member states. The member states did not agree on the text. So, basically what you have is the World Health Assembly saying, we're going to keep working on this thing. That's kind of what happened. And their next scheduled meeting is going to be in July. They're going to aim for it to get it done in about a year, but they're just going to keep working on it.
So you think that maybe they want to just kind of wear down the opposition, thinking that we'll just go away?
That could be part of it. I mean, the pandemic agreement deals with issues that are very serious and much more ingrained in the way they would lock together member states than even the amendments to the health regulations. So this is something that really needs a serious look by anyone agreeing to it.
All right. So, Travis, you were there. You've dissected. You've come through the amendments to the international health regulations. It's very comprehensive. I mean, we're talking 62 pages. What's the practical implication for Americans with what was adopted on Saturday? And is there an opportunity to pull the plug on it still?
Yeah, the practical implication is that the Biden administration was all in and trying to get this done. The United States was one of the countries that pushed to try to finalize the regulations this week. So the Biden administration is really committed to what the WHO did here. So the practical impact is I think they're going to aggressively try to do everything they can to implement these, and that's going to look, like further regulation and planning within the executive branch of the federal government, working with state health authorities. The new regulations call for increased coordination both within countries and between member states.
Right. And one of the things I saw in here that you pointed out was that it went from a consultation role to a basically mandating that member states shall do what the WHO puts forward.
There were several points at which language changed from the previous version of the IHRs, from less restrictive language to more restrictive language on member states. That's very important because that's just going to tighten the net. And the WHO is they're going to try to say, you have to do X, Y, Z. But it's important that member states recognize the context this was in. It's always with the cooperation of member states and their voluntary implementation of this that this will be implemented at all.
So we can get out of it if we had the right administration. They could easily pull the plug on this. But final question for you. We've got 30 seconds left. This is, as it stands, an attack on sovereignty of member states, including the United States.
You clearly are going to be bound to this by the terms of it, the way it locks member states in, the way it requires them to share resources, information, and weaves a web under the WHO. That's something we have to look at. You can see it in the text. And folks can do that on our web page with the WashingtonStance.com/WHO. All
right, Travis Weber, thanks so much for your final report. I know we're going to talk more about this in the days ahead. And folks, you can find out more. Text WHO to 67742. We'll keep you updated. We're not going to let go of this.